No.
Good morning and welcome. My name is Nobat Atkunda. Today we are having an insightful discussion on cardiopulmonary diseases. We are coming to you live from the Aga Khan University Hospital, Nakawa Specialty Center. This term covers various conditions affecting both the heart and the lungs. In Uganda, these diseases are among the leading causes of illnesses and death. For instance, at the Uganda Heart Institute, 500 to 600 surgeries are performed annually, yet many patients still seek specialized cardiac treatment abroad. Many people don't fully understand these diseases, so let's start with the basics. Joining us is Dr. Deo Senkumba, a general practitioner. Doctor, what are the common heart and lung diseases in Uganda, and what causes those diseases?
So heart and lung diseases are basically, just like the name goes, are just diseases affecting the heart and the lungs. They're just that. Sometimes technically you can call them cardiopulmonary diseases, but in simple layman language, they're just diseases of the heart and lungs.
Let's talk about the risk factors, or what habits or conditions make someone to likely get these diseases.
The common heart and lung conditions we see, there are two areas. So for the heart conditions, the commonest is hypertension. So hypertension causes a lot of other heart-related complications, and actually it is classified as a heart disease. Then we have there's a disease called endomyocardial fibrosis. It is very common in rural areas, and it's a disease of poverty. Basically, these people get heart disease in childhood, and it's usually they get very enlarged stomachs. So the common heart diseases in Uganda here are hypertension and its related diseases, and rheumatic heart disease. Rheumatic heart disease is a disease of the valves in the heart. The heart has valves, and they get damaged because of, as a side effect or as a follow-up to common throat infections. Then the lung diseases, we have asthma. I think each and every one of us has had a relative with asthma. Then we have COPD. There's a disease called chronic obstructive pulmonary disease. It happens when your lungs get damaged for a long time from any cause. For example, if you use firewood to cook, especially in rural areas, if you use firewood to cook, we do get a lot of cases of people with damaged lungs because of exposure to biomass smoke or smoke from firewood for a long time. It can also come from smoking. Smoking can damage your lungs. Although the smokers are not so many in Uganda, we also see such cases. Then we have TB. TB is very common in Uganda. It stands for tuberculosis. It's an infection of the lungs from the Mycobacterium tuberculosis. So it's also a common cause of lung disease. And even after you're cured of TB, some patients do remain with complications because of the scarring that is associated with the TB disease. Even when the TB clears, you may remain with some leftover lung complications. Hypertension is wide, but there is no single cause of hypertension. So when a disease does not have a single cause, like we can say malaria is caused by the malaria parasite, we now start talking of risk factors. So we may not know in a particular patient, when you come to the hospital, we may not know exactly what has brought your pressure most of the time. Of course, there are exceptions. So most of the patients who come to us have primary hypertension, meaning we don't know the underlying cause, but there are risk factors like obesity, like smoking, like consuming unhealthy diet. Unhealthy diets are diets rich in salt, rich in processed foods, rich in saturated fats, and sedentary lifestyle. Most of us have a sedentary lifestyle. You live morning in your car, go to the office, stay there all day, go back in your car. That's a sedentary lifestyle, puts you at risk of hypertension. There are a few patients who have hypertension where the cause is known. For example, kidney disease. and some hormonal issues and pregnancy. But those are the minority. Most of the cases of hypertension, the exact cause is not known.
You talked about firewood. Let's look at air pollution as well. Is it one of the factors that contributes to lung diseases, especially in Uganda?
We do know that lungs can be damaged by any noxious substance, and all the ones you've mentioned do contribute. So if we have cleaner air, you expect fewer cases of lung disease. And the more the pollution, whether from fumes of cars, whether from factories, whether it's just something as innocent as the firewood, the smoke from the firewood in your kitchen, it can put you at increased risk of developing lung diseases, specifically asthma and chronic obstructive pulmonary disease. So different heart and lung diseases have different risks. I'll talk only about the most common, which most of our viewers are likely to come into contact with. Hypertension, we already mentioned that the most common risk factor is a sedentary lifestyle. So you're supposed to get out of the chair and run, jog, do some aerobic exercise. The recommendation is to have at least 30 minutes of exercise every day for most of the days in the week. In that case, you are no longer considered to be sedentary. Obesity, we are seeing increased cases of obesity, including children. And let viewers know that even children can develop hypertension, especially if they have a strong family history. If in your family, most of the people, we do see patients where most of the people in their families develop hypertension. And so such people are at high risk of developing high blood pressure, even in childhood. And obesity is increasing, childhood obesity is increasing. So we also see such people developing hypertension and diabetes as children.
When you talk about obesity, let's also look at child obesity. That is now a concern that most people are coming out to talk about it. What are we doing wrong as parents?
Obesity in children, the biggest cause is the sugary foods. So ideally, a child is supposed to eat a normal balanced diet, not sugar. If the largest portion of your child's diet is sugar, then you do not be surprised to get obesity resulting. So you have to cut away the sugar. There are certain countries like the UK where they regulate the amount of sugar entering people's diets and the amount of salt entering people's diets, but we are not yet there in Uganda. So the onus is on you as a parent to control, reduce the amount of sugary foods, instead offer wholesome foods, like instead of offering a sweetened juice, you can give your child a banana or a mango. It is healthier. It is quite, when your child is taken to the hospital and measured, the doctor can use a measure called body mass index to know whether your child is obese. Aren't we going off?
When it comes to symptoms, what should I look out for, or what should people look out for?
So the symptoms of heart and lung diseases, they are similar. The commonest, if we start with heart diseases, the cardinal signs of heart disease are cough. You may get cough for a long time and you don't know what is causing the cough. Tiredness, when the job of the heart is to pump blood to the rest of the body and ensure that the organs get enough food and oxygen to do their work. So when your heart is getting sick, you'll find that you get extremely tired. Simple everyday activities like walking up a flight of stairs may tire you out, and you may get twisting or pressing chest pain. You may get body swelling. If your heart is totally failing, you may start getting swelling of the feet. Actually, it can even be of the whole body. So the cardinal symptoms are swelling, chronic cough, easy getting tired, what we call easy fatigability. And you may also get something we call orthopnea, where someone is unable to lie flat in bed. Find yourself, if you lie flat in bed, you choke or you become breathless and you're forced to sleep propped up by a lot of pillows. And if you look at lung diseases, they are also similar, like asthma. Most people assume that asthma is a disease where you always get a wheeze. If most of you know what a wheeze is, that sound in the chest. But asthma can also come with a symptom of chronic cough. Someone may cough for 2 months, has never wheezed, but it could be asthma. So you need to go to your doctor and get checked.
Let's give an example. If someone gets short of breath or feels chest pain, should they be concerned?
Yes, it is concerning. If you get shortness of breath or chest pain or coughs that do not go away for a long time, those are red flags for heart and lung diseases. For example, patients with TB mostly come with cough for at least usually 2 weeks or more. But it could also be a heart problem, it could also be asthma, it could also be COPD. So those are the common, they interlink. Those are the common signs of a heart or lung problem.
Recently, the Aga Khan University Hospital Nakawa Specialty Center introduced specialized services to treat these diseases. Can you elaborate more about these services?
Yeah, Aga Khan University started an outpatient facility with specialized services. So one of the areas we have is the cardiology and pulmonary department. That means the heart and lung. So we do have a stress ECG machine. You will probably have a look at it. That one, it helps us to know, it can stress someone's heart to see if you are developing, there are certain heart diseases it can diagnose, which I won't go so much into the details. We do have ECGs, we do have echo, state-of-heart echo machine. It's an ultrasound or CAT-TV. I think locally people call it a CAT-TV. There's a CAT-TV that can look at your heart, and that one has to be done by a heart specialist. Then we do have a CT scan. A CT scan can take pictures of your heart as it is beating to be able to visualize the blood vessels of the heart. If the doctor is suspecting that your blood vessels of the heart may have blockages in them or plaques, we can do a test called CT pulmonary angiogram to look at that.
Let's talk about the cure. Can these diseases be completely cured, or is it just about management?
It depends on the disease. We've seen 4 common diseases like TB. TB is an infection that affects the lungs. It's very common in Uganda. It can be cured. You take medicine for, I think, 6 months, if it is a pulmonary TB, and you're actually declared cured. Some are not curable. You just have to be managed, like hypertension. Most of the cases of hypertension are not curable. Of course, there are exceptions, but for the vast majority of the diseases, most of the diseases are for being managed. There are some which are curable, like TB. Asthma itself has no cure at the moment. Things may change in the future, but it's about managing your asthma so that things do not get worse. The earlier you report, the more we are able to preserve your lung function. Yes, so there's a lot of mismanagement of asthma. Most people are just put on the simple inhaler, the salbutamol inhaler. So the latest teaching shows that that's not the way to manage asthma. You need to see your doctor regularly to preserve lung function. Asthma can kill when you present very late. You may get a life-threatening asthmatic attack. So it is potentially lethal. But early presentation can make a difference.
Lastly, what's your advice to the public? How do I keep healthy to prevent myself from getting either a heart disease or a lung disease? What do I need to do as a person?
So for the heart and lung diseases, you notice that there are some risk factors that are not modifiable. For example, you can't modify, there's something I didn't mention, that premature babies. We do see a lot of premature babies developing lung complications. So you cannot modify the fact that you are born a premature. You cannot modify the fact that in your family you have a history of hypertension. But there are modifiable risk factors. Even though in your family you have a risk of hypertension, avoid being obese. by reducing unhealthy diets. What are unhealthy diets? They are diets rich in processed foods, so you are always buying packaged foods from the supermarket. They are diets rich in salt. They are diets rich in saturated fats. So prefer a plant-based diet, prefer unprocessed food, prefer little salt, prefer little sugar. Exercise. Recommended level of exercise is at least 30 minutes of aerobic exercise. Aerobic exercise is exercise that makes you sweat, that makes you pant, like a brisk walk or jogging. And it has to happen for at least 30 minutes each day.
Exercise, eat healthy, and mind your lifestyle as advised by the doctor. My name is Norbert Atkunda. Good morning.